Hi, my name is Judie VanKooiman, and you're watching Life Issues. This month's show is about Stop Healthcare Violence, and my guests are Sheila Wilson and Liz McTomey. Welcome, ladies.
Thank you.
Thank you. Thank you for having us.
My pleasure. Thank you very much for coming. Sheila, I'm going to start with you. When was healthcare violence founded?
We started healthcare violence. There was 3 of us that got together in 2008. In 2009, I became the president of Stop Healthcare Violence. And in 2019, we became nonprofit.
Oh, well,
so this is brand new. Thank you. Thank you. That was a lot of work. Yes,
nonprofit.
It is.
Yeah.
It is.
It's very important to nonprofits are. So.
Yes, and I'm finding that out more and more every day.
Yes. And why did you want to start this organization?
Well, I've had a great career as a nurse. I've been a nurse for over 40 years, and the last part in the hospital, I was working in the emergency room, and we were getting really assaulted verbally and physically all the time. And there was a few of us that really were paying attention to it. I mean, when you get hit and slapped, punched, kicked, cut, we needed to sit down and look at the issues and try to do something. So that's how Stop Healthcare Violence really got started, because of our awareness of what was happening.
Right. Oh,
Could I add something to that?
Of course.
As Sheila said, everything that she said is correct, but one of the reasons that I personally got involved is because of the lack of response from the hospital. You know, we would tell them what's going on, and it was almost like, well, what would you like us to do? You know, instead of working with us to either get more staff or to find some way and somebody that we could talk to as a group. Because I've been a nurse for 30 years, and I've had positive experiences, and I'm happy with the position that I took. But the last couple of years were just, I couldn't watch my coworkers get hurt anymore.
Yeah, here you're trying to take care of people. That's your field, and you apparently like doing that, but then you're being, abused, so to speak.
Yes.
Well, I think what happens is, because we're nurses and we care, you're giving patients a lot of leeway, because they don't feel well, their families are all upset. You're trying to work so that our job is to sort of calm you down and educate you as to what's going on. So when someone throws a left at you, it's out of the blue. You don't expect it.
Right.
Because I would never hit a patient.
No.
It's, as far as nurses go, we give excuses. We don't hold people accountable, and there's no reason to get assaulted. Right. But at this point, I just want to say that Stop Healthcare Violence is not going after people with Alzheimer's or seniors that are frightened, or somebody that comes in with a low blood sugar and starts floundering around, or somebody that's having a seizure and they're floundering around. We're trained for all that. We're trained for the psychiatric person that is totally psychotic. Those are not the people that we're talking about. We're talking about the ones that Liz had just mentioned with the left hook, that you're putting in an IV, and all of a sudden you have the arm and you're being very careful so that you don't hurt with an IV, and you get clubbed or you get punched in the stomach. That's the patient that needs to be held responsible.
Right, right. And what is your mission statement?
Well, my mission statement basically is to educate the public, to educate the nurses, to make sure that we're safe, protect each other, and to make sure that our environment is safe. And if we're not safe, our patients aren't safe. So that's a quick rundown of our mission statement.
It's very important things, yes. And Liz, can you please define workplace violence?
If it's okay, I'll read the definition of it. According to OSHA, Organizations have defined workplace violence in various ways. The National Institute for Occupational Safety and Health defines workplace violence as a violent act including physical assaults or threats of assaults directed towards persons as they work on duty. Enforcement activities typically focus on physical assaults or threats that result or can result in bodily harm. However, many people who study this issue, verbal abuse, hostility, harassment, it's not a big deal, but they can cause significant trauma and stress. And even if there's no physical injury that takes place. And I'm also thinking like the paramedics and the EMTs, it's not just nurses. I mean, it is the majority of nurses.
Right.
But the EMTs and the paramedics, they're walking into a totally unknown environment too.
There was just 2 stories recently in the news about
Yes.
paramedics. Yes.
But that's been going on for years. And when Liz and I both worked in the same emergency room, and these paramedics would come in and they have been pepper sprayed or maced. They've been kicked down the stairs. They'd be carrying a patient on one of the chairs, and then somebody would come and try and trip them. And these EMS, at least the ones that we know, they are good-hearted people. They're the ones that, if they brought in a patient, they'd help us. And they're just, there's no reason for this. There's no reason for all the violence that's going on.
Right. Sad. How can we as a public help, Liz?
I think that we can help just by doing this. A lot of education, and also if you're in an environment where there was some type of injury or someone's been assaulted, you need to file reports. If there's not a paper trail, it didn't happen.
Right.
You know, we can have 5 people say, oh, I saw her, I happened to be one night next door in the stall to Sheila, and I heard her get slapped. And I'm like, what the heck? And then she pops her head out, and she's got a cheek. Her face is all red.
Oh, ouch.
And
was a
all she was doing was putting an IV in, and all I was doing was asking the person, and I could hear it so clear. I thought that something broke. Somebody dropped something.
Right.
And it was really, it's upsetting to me to watch another human being get hurt. When there's, as you say, with people that aren't in their right frame of mind, that's not the people we're talking. I know how to deal with those people. I know how to deal with people that have had a lot of abuse in their life. I don't expect to be whacked when I'm just trying to get your name.
Right. Just doing your job. A job that you love.
I did love
Yeah.
I loved nursing.
Yeah. And Liz, why did you want to be part of the Stop the Healthcare Violence?
I personally got attacked. And if it wasn't for the EMTs and my other nurses, they would have, what happened was the patient had jumped on top of me, but I was standing in front of the stall where there was this little old lady that was in there for pneumonia or something, and my biggest fear was that I was going to fall on her, and she probably weighed about 40, well, that's an exaggeration. She probably weighed about 80 pounds. She was just a little tiny thing. Plus, she was startled and she was scared, and I was trying to sort of not make a big deal out of it because, I didn't.
You had a patient on your back. It was awful.
It was awful. And then I was out of work for probably 3 months because she tore my rotator cuff. And if it wasn't for the EMTs and the other nurses, I would have been really significantly hurt because she was very angry about being in the hospital. She had a drinking problem and a substance abuse problem, and she was angry that she was there to begin with. So all I did was walk by the room. I hadn't even had a chance to go in and talk to her. And she was just out of control.
But it took 7 people to get that patient off
And she was
Liz's
a
back.
young girl.
She just jumped right on, her hands in the front, her legs up by her waist, and it was devastating.
No, that's too bad. Sheila, can you please tell us about House Bill 1578 and the 838, the
Yes.
Senate bill?
I have the bills right here, and the Senate Bill 838 is sponsored by the Senator Michael Brady, and what it is an act strengthening the penalty for assault or assault and battery on an emergency medical technician, ambulance operator, ambulance attendant, or a healthcare provider. The same bill is the House Bill 1578, which was sponsored by Representative Paul Tucker, who was a police officer and he was the police chief of Salem. So he's a great asset for, well, I feel, for nurses, because the police, when we get assaulted, can't come and arrest the person because they didn't see what was going on. And it's just, that's kind of like a barrier for the nurses to report the assaults, because they know nothing's going to be done at that point. But yes, a policeman can take the report, or you can go to the police station and make the report, and then they'll give the report to the DA, and it can work that way. But it's frustrating when you're sitting there with your face all bruised and swollen and bloody and everything else, and they say, "Sorry, ma'am, I can't do anything because I didn't see it," and you could just scream. But this fella, this Paul Tucker, Representative Paul Tucker, could probably help a lot of us to help. And it's the same identical bill, and it's the same identical bill that was issued back in probably 2010 when Governor Deval Patrick signed in as a misdemeanor. This bill could change the Massachusetts law from a misdemeanor to a felony if it ever gets passed. And it just, I don't know what the problem is, that Massachusetts doesn't have a felony law, but 34 other states do. And so why? And there's no statistics for me to stand up and say, now, all of these states are getting better with the violence because of the felony law. There's nothing that's statistical important about it. But strengthening the laws would be a help, maybe.
Yeah. And Sheila, can you please share some true stories about?
Oh, we could share true stories for a month, but we don't have that much time.
Right.
Let me start off with the story about this lady that slapped me, that Liz heard. And I had already done most of the stuff, and I put her into a room, and security was with me. And the second that the security guard that was protecting both of us, he decided to leave because I asked the female to take her clothes off, take her shirt off.
Right.
He says, "I'll give you some privacy." And that's when she slapped me. That was why she slapped me, because security left. And I mean, he did it because of the privacy issue.
Right,
He thought that he was doing her a favor.
You're right.
The biggest assault, I mean, I've been hit, kicked, spit on, punched, the
Sworn.
scratches, the swears. I mean, these guys think that they're swearing, like we wouldn't know these swears. I mean, some of them I think we invented, but they're just so crude, and they try very hard to get you intimidated. You know, if there's anything the matter with you, if you're limp, they're going to start talking about your limp. If you're oversized, they'll be calling you names and stuff like this. These are the folks that need to be held responsible. But there was a gentleman that came in by EMS, and he was just a small frame fella, and we had him down in the room. EMS had put him on the stretcher, and then they came to give me a report. And all of a sudden, while they're giving me a report, the paramedic that I was training went by, and he says, "Sheila, your patient down in room 6 is on fire." Now, you got to realize that a patient on fire is not what really goes in your brain in an emergency room. Sheila, your patient is having a GI bleed. Sheila, your patient is having chest pain. Sheila, he just fell out of bed, but not on fire. So we ran down to take care of it. The paramedic got it out, but what this little guy did was he little squished down, and he took the lighter out of his pocket and put the restraints that was on his hands that the paramedics put on, because he was kind of a touchy-feely guy. But what happened to me is the embers that came from that fire went into my eye. And I went to the ophthalmologist the next day, and he said if it was any worse, I would have lost the vision of my eye. And that was really bothersome, because that's like, could change my whole world.
Right, exactly.
But that causes a lot of trouble. Now, there was a young girl she took report. It was a very, very busy night in the emergency room. She took report from EMS. She knew the patient. She said, I'll just take him. We had to switch beds around, and she puts him in the room. And she introduced herself, and hello, remember me? I met you in the ICU, and da-da-da. And he said, call my wife. And so she said, you certainly can call your wife. Just let me do your blood pressure. Let me put the monitor on. And he punched her so hard in the face that she moved into all of the cabinets in the trauma room. And she still did. I wasn't in charge, but I told her she was going home. She didn't want to go home, but she called her husband, and so off she went. And the next day, it was her daughter that looked at her face. She was black and blue from the top here all the way down, almost like half of her face. And it was when her daughter started to cry and say, what happened to your mom? Now, she just had breakfast with her, and, she was a kid. She was 15 maybe, going off to school, never really looked at her mother until she sat in the car. And she told her. Another patient, did you want to talk about Paula? What happened to her? Do you remember Paula?
I don't remember Paula. I mean, I remember Paula every time I turned around, Paula was like a punching bag.
Right. There's one particular time that ended up having Paula be out she's on disability.
She was out for a long time.
She was coming in from triage and happened to see a patient beating up the security guard on the floor. The security guard was on the bottom. And so she yelled for more help, yelled for a stretcher, and then they're trying to get this gentleman up onto the stretcher. They got 3 limbs restrained, but it was that one leg, and he kept
he had his
in the chest. And her shoulder. He had his boots on, and he kicked her. She just couldn't get that leg saddled down, so she ended up out of work and then out on disability.
Wow.
She was on Channel 5, I believe, the I-Team. And there's just so many stories.
Yeah.
There was a woman that one of our co-workers, am I taking too much time? Okay.
But those are very important to let our audience know about and stuff, that those things do happen to.
They do,
Yeah,
frequently.
If I could just add one thing. Not only are the nurses being hurt, but the patients around that are watching this are terrified.
Right, of course.
And, they want to leave, they want to get it. So now they're acting out because they're so scared.
Yeah.
It's just not right.
Yeah, that's understandable. And Sheila, what services do you provide?
For Stop Healthcare Violence, We provide a lot of education. We provide support. We provide encouragement. And just recently, we put up a support group online, and that's Heal the Healer. And Liz Dalton is supporting that, but it's brand new. And as I mentioned earlier, we're going to start self-care groups on cable.
Nice. Good.
And so this is keeping them in the loop. They need the help.
Yeah, right. And Liz, how can people stop the healthcare violence?
I don't think you're ever going to stop it, but one of our goals is to make the public more aware of it, to make nurses realize they should not be abused. I mean, this here is great, supporting nurses that are hurt instead of just going about your business. They've got to report it. They need support. They need to figure out, because it's traumatizing, and they need to figure out, do I want to go back into this environment, or do I want to find another way, to service my patients? So I think that as long as you make the reports, the hospital is aware of it and sets up systems that you can go to should you need it. What's that? Oh, employee assistance.
Yes.
That's what we need. And they need to come down and talk to nurses and other people.
All right.
It's just changing the culture. It's not part of the job to get assaulted.
No, definitely not. No. And Liz, you have some links posted on your website. Can you tell us some of those?
Oh, I can talk about
Okay.
them. We have a lot of links, and we have like M&A, and we have ENA, the Massachusetts Nurses Association, Emergency Nurses Association, the American Nurses Association. Each one of those has toolkits in violence prevention, so anybody can go and do it. We also have like the Bureau of Statistics and all of those links, and they're great for knowledge. And if nursing students are out there trying to make some sort of a term paper or whatever they write now, they can just go and click on them, and they're very useful, very useful.
Great. Good. And Liz, do other states have these issues too?
Oh, yes, all over the country. I
Sad.
was a traveler for a couple of years, I traveled from state to state, and I worked in the emergency room in California, Connecticut. I didn't go to New York. California, Connecticut, Rhode Island, and Arizona. And they were constantly talking about nurses getting hurt.
Wow.
And it makes your staff, you're short-staffed, so it makes you more aware that you really have to be on your guard. And nobody wants to do a job like that where you have to sort of back up and, it's hard.
Yeah, definitely, definitely. And Sheila, you wrote a book. What is the name of it?
Oh, my book, it's The Shocking Reality of Violence in Healthcare and What We Can Do About It.
Okay. And why did you want to write it?
Well, I don't know whether I'm naive in a lot of ways, but I also feel as though we as the healthcare workers, if we sit and say and do nothing, nothing's going to change. So we need to say something and do things.
Right.
So that was part of my contribution to mankind, and try to see if the nurses, once they get finished reading this book, realize it is not part of their job, to really accept that, as I said earlier, changing the culture. And the fact that it's the employer is, by law, supposed to keep it a safe place, but if they don't know, if we're not making out those incident reports, if we're not calling the police, if we're not doing what probably we should be doing, how is the administration going to know? And so it's all in the book. It's all of these things, and there's been a lot of nurses that participated in that book.
Yeah. And where can people purchase it at?
Amazon, I guess, is the favorite.
Okay.
And so that's up
easy.
there.
Okay, good,
Thank you.
good. And Liz, what is workplace violence in nursing? Is that what we had talked about earlier, about the different violence things that patients were doing to nurses?
It's definitely, it's been a culture, particularly in the last couple of years, where it seems to be heading in the wrong direction. So workplace violence is just exactly what workplace violence is. You know, it would be the same as someone going postal. It's that type of violence.
Right. Okay.
But unless you work in that environment, you don't really believe that it could possibly happen, because why would somebody beat you up when you're trying to do it? But
Right.
it happens.
Right. And Liz, if anyone has any questions, can you please give us your contact info?
Do you want me to give them yours?
No, give me your email address.
My email is emctomney@rcn.com, and I'd be happy to talk to, I'd be particularly happy to talk to nursing students and nursing teachers, because these kids need to be prepared for what's out there.
Right.
I mean, I was very seasoned, Sheila's very seasoned, and I can tell you when I first went into nursing, it wasn't like this.
Right. And Sheila, if anyone has any questions for you, can you please give us your contact info?
Sure. Email is info, I-N-F-O, at stophealthcareviolence.org, all lowercase. And my other email is Sheila, S-H-E-I-L-A, W6 at Comcast.net.
Okay.
And I will answer any email messages.
Okay, great. I'm sorry, but that's all the time that we have. Thank you both for all you do for those in need. I'd love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life.